disorder. You'll find free practice material, including multiple choice questions, flashcards, and case scenarios available through Wisdolia that gives you feedback as you answer on what you got wrong and why. Find the link to the autism set below. Autism spectrum disorder, or ASD, is a neurodevelopmental condition classically characterized by social interaction and communication difficulties with restrictive, repetitive behaviors and interests. As the name suggests, a spectrum of different presentations is possible, ranging from severe disability all the way to cognitive strengths. This is important because historically, the term Asperger's syndrome was used to describe those with higher functioning or higher IQ, but is now considered part of ASD, as are other neurodevelopmental conditions.
क्या आप मानोगे अगर मैं आपको कहूं कि पेस्ट्री शेफ बनने का एक 100% proven step-by-step method है?
Part of ASD, as are other neurodevelopmental conditions like childhood disintegrative disorder. And it's worth noting, ASD is now becoming increasingly seen as an example of neurological and cognitive variation between people. As we mentioned, the clinical presentation can vary greatly, but the two core domains affected are social communication and interaction, and repetitive, restricted, or stereotyped behaviours, interests, or activities. In children, the manifestations depend on the age as well as the domain involved, with over 80% of affected children displaying signs of ASD before 24 months. Example symptoms affecting social communication and interaction include delayed nodding or shaking of the head, a lack of vocalization or babbling, or delayed language, some of which may be non-verbal, while others may have early language development and have adult-like speech. There's often fewer facial expressions, and one of the most sensitive markers is not pointing at objects of interest, instead touching or guiding the caregiver's hand to it. This may be because of what's termed mind blindness, or a lack of theory of mind, where people with ASD are not able to imagine what another is thinking, and so the child cannot imagine that someone else would understand what was being indicated by pointing. Examples of restricted, stereotyped behaviour include repetitive movements like flapping, becoming distressed beyond expected with a change in environment, or extreme under or overreaction to sensory inputs. Another is not playing games like peekaboo or not playing with other children. Regression of language before 3 years of age is also considered a red flag for possible ASD, and regression above this age would warrant investigation for an alternative cause. In older children or adolescents, manifestations can include frustration making their feelings known, often with emotional outbursts, restricted and ritualistic approaches to eating and drinking, and difficulties forming friendships. In adults, ASD should be considered if there are one or more of social communication or interaction difficulties, stereotyped restricted behaviour, or resistance to change or restricted interests that have an onset in childhood, and one of difficulty in finding and keeping employment or education, previous contact with mental health or learning disability services, and difficulty in initiating or sustaining social relationships. Often, adults with ASD will present during times of stress in their lives. Overall, over time, people will often learn to mask their ASD, especially females, and of the people with ASD, 40 to 80% will have an intellectual disability, and often there is an uneven cognitive profile, where people are relatively stronger or weaker in different cognitive tasks. Roughly 20 to 30% will also have epilepsy. The exact pathophysiology is not currently known, but it is thought that ASD is the result of a combination of factors, one of which being genetic influence, with 50 to 80% heritability, which is the proportion of the variation that can be attributed to genetic factors. However, most children with ASD do not have an affected relative. Around 10% are linked with genetic syndromes, like Fragile X syndrome, tuberous sclerosis, or Down syndrome. Prevalence is estimated to be 1 to 2%, with it being around 4 times more common in males than in females. However, it's considered underreported in females, possibly due to differences in presentation and severity, but also because screening tools may be less accurate in females. Other risk factors include sodium valproate exposure during pregnancy that appears to be dose-related, increased maternal and paternal parental ages, and prematurity. In the past, it was thought that vaccines may have caused ASD. However, current evidence states that this is not the case. A diagnosis is typically made by a specialist and is clinical, meaning it is based on the history and examination rather than any specific test. There are some standardized interviews and observational assessment tools that may be used as part of this. For example, in adults, the Autism Diagnostic Observation Schedule and the Autism Diagnostic Interview Revised. ASD screening tests are also available, but should not be used alone as a tool to decide whether specialist referral is needed or not. For example, the Childhood Autism Rating Scale. Many of these tools are based on the DSM-5 criteria, which require persistent deficits in social communication and interaction across multiple contexts, including all 3 of deficits in social reciprocity, in non-verbal behaviors used for social interaction, and deficits in developing relationships. There must be restricted, repetitive patterns of behavior, interests, or activities, with at least 2 of stereotyped or repetitive motor movements, inflexible adherence to routines or an insistence on sameness, restricted fixated interests with abnormal intensity of focus, or hyper or hypo reactivity to sensory input. These must be present in the early developmental period, cause clinically significant impairment, and cannot be better explained by intellectual disability or global developmental delay. Children with social or communication difficulties should receive a hearing test, and a full neurological examination with measurement of head circumference is also done, as there is an association between macrocephaly and ASD. As we mentioned, conditions like Fragile X and tuberous sclerosis commonly feature ASD, so children with ASD and intellectual disability or dysmorphism may undergo further genetic testing. Treatment and management involves maximizing the function and quality of life of the individual and supporting their families or carers. Management is generally delivered through a multidisciplinary approach, and also often included are the parents or caregivers. It's important to remember that the needs can vary greatly between individuals, but also can change within that individual over time. Applied behavioral analysis is an approach where behavior is analyzed and subsequently matched with appropriate strategies tailored to suit that individual. This approach involves teaching skills with small, progressive changes over time, including in cognition, communication, self-care, and even employment support. Speech and language therapy is also frequently used and can feature a range of communication methods, including speech, pictures, and speech-generating devices. In some cases, physiotherapy and occupational therapy are useful, particularly in those who have deficits in motor function, planning, or sensory processing. Pharmacological therapy is not typically used for core features of ASD, but in cases where there is no response to behavioral techniques, antipsychotics like risperidone or aripiprazole may be used, and associated disorders like depression, anxiety, OCD, and insomnia may benefit from pharmacotherapy, usually alongside cognitive behavioral therapy. Dietary modification has not been found to produce a significant benefit.